It appears that teenage girls in custody face far more challenges than boys. A new study by the San Diego Regional Association of Governments shows that girls entering juvenile hall are more likely to have come from abusive homes and to show signs of mental health problems. Joining me are Cynthia Burke, Director of Applied Research at SANDAG, and Kim Allen, Deputy Chief of Juvenile Field Services. Welcome to the program.
Thank you.
Thank you. Cynthia, what are the most stark differences that girls in detention face versus boys?
The two biggest differences we saw was that girls were much more likely to report that they had family contact with CPS, Child Protective Services, 64% compared to 15% for the boys, and also they were much more likely to run away from home. Why that matters is that many girls who come into the system come in for less serious crimes, status offenses, which only juveniles can be arrested for, not adults, like running away, truancy. But there are underlying risk factors there that we need to look at. If we just put them into the system and just punish them, we're not dealing with that underlying trauma. There's also much more common substance abuse. They try alcohol earlier, and they're also using meth, ecstasy, LSD, and spice, manufactured source of marijuana. So we want to look at that, because if we don't address those underlying issues while they're juveniles coming into the system, they're going to be at greater risk as adults to continue on, because they're going to keep acting out in ways that the justice system may say is a crime: prostitution, surviving sex acts, and also substance abuse. So we want to get that early on.
So the girls are trying meth and alcohol as early as 11. Where are they getting this from?
It's all out there. We ask them how easy they think drugs are to get, and we find that over 90% are saying marijuana is easy to get out there. It's out there. They are getting it from friends, other parents' homes. We also ask about prescription drug abuse, and we're finding that those youth who are using substances illegally, like the meth and the marijuana, the cocaine, they're also using prescription drugs. It's out there. It's a world we live in today.
And do Cynthia's findings, do SANDAG's findings support what you're seeing out in the field?
Absolutely. We're seeing a higher occurrence of girls using substances, and the girls that are coming in are using more than they have in the past.
And what sorts of programs is the juvenile detention facility offering to maybe meet these girls' needs?
Well, the probation department has gender-specific programming, both in custody and out of custody. In our girls' rehabilitation facility, we have specific programming regarding trauma, the prostitution issues, family, communication, parenting. We have public health nurses that work with girls, because some of them are parents themselves. Outside of custody, we have programs such as the WINGS program, working to ensure and nurture girls' success. That is a gender-specific program for girls, targeting risky behaviors early on, be they substance abuse, truancy, runaway behaviors. And we're looking closely at trauma. So any trauma that a youth has experienced in the past, we're looking at that and trying to determine how we can best address the trauma so that we do not re-traumatize them once they're in the system.
And Cynthia, I think it's important, I'm sorry to interrupt, but I really think it's important to emphasize that these services are available around the county. And a girl doesn't need just to get into the system to get access to those services. Probation has done a great job of providing services from prevention through this graduated sanctions once they've already been adjudicated through the system. Absolutely. And so if there are these systems, these warning signs, and that's the message we want to get out. If you work with a juvenile, if you see a girl who's having these issues, there are services out there if you call probation.
And why are girls facing more challenges? Do they simply have more stressors in their lives?
We find that many of the risk factors for boys and girls are the same, except that the exposure for girls are greater. So, for example, the sexual victimization that could happen in a home situation, and also how they deal with those. Relationships are important to everybody, obviously, but girls are much more likely to be affected by that. A mentor can make a difference for them. If you see a girl who is starting to act out in a way that might be a more traditionally a juvenile delinquency issue, there might be those underlying issues. Don't be afraid to step up and help them.
And are there more programs that are gender-specific planned because of these findings?
Absolutely. The probation department has actually recently applied for a grant related to crossover youth. Those are youth who have had an experience in the dependency system and are at risk for crossing into the justice system. So there's a lot of discussion and education out there regarding trauma-informed care, working with crossover youth, and keeping kids from either coming into the system altogether, or if they are in the system, preventing them from going further into the system and crossing over into the adult system.
Okay, Kim, Cynthia, thanks for coming on the program today.
Thank you.